What's your birthday? Do you smoke? And would you like to register to vote? Turns out you can register to vote while signing up for Obamacare. Nick Novak made that discovery not too long ago. Nick is with the McIver Institute. What does signing up to vote have to do with Obamacare?
You know, that's a really good question. I have yet to figure out why they want everyone to sign up to vote on the Obamacare website. They can't even get the healthcare aspect of it to be working correctly. It's been 2 weeks, and people are having issues signing up every single day, and it's just a disastrous website, to say the least. So why they're trying to add other things onto it, I simply don't know.
Well, are you reading something into this? Because the question is, would you like to register? That's a fairly innocuous question. You don't have to sign up to vote. You don't have to. That's not a prerequisite of signing up for Obamacare. And they don't ask you, what is your political affiliation? Are you reading into this that the Obama administration is trolling for votes via the Obamacare sign-up system?
You know, I think the biggest issue you have to look at is, A, after I entered all my personal information in trying to figure out what the rates were here in Wisconsin, I had to go through a lot more steps before I could even find those rates. And one of the steps before that was asking me to register to vote. So I think that if they were going to do this correctly, A, the website should have been up and running properly and not be giving so many glitches to individuals trying to sign up. And they should probably take all these extras out that have nothing to do with signing up for healthcare.
Well, your organization tried to get through. Were you successful in Wisconsin? Could you get through and sign up and make your selection?
Well, I first started trying to sign up on the first day when Obamacare went live on October 1st, and I had so many issues that we finally gave up for a few days, so we went back last Thursday and Friday, and it basically took me all of Thursday and Friday to actually get through the application process because it had crashed so many times, and so even on Friday I still was not able to get in. I did try again this morning, had a few issues, but I am hoping to get through.
At any point in Wisconsin, as you were trying to get into the system, could you make a choice? Could you say plan A costs this, plan B costs that? Were you ever at that point?
It finally did open up today that it gave me some options, but it still took me quite a while to actually get through. And the different comparisons that it gave me didn't even give any of the options for what the subsidies might be. It just showed what some of the premiums were. And it was still quite a complicated process to get there.
All right, we hear you. Nick Novak from the McIver Institute. Thanks for joining us today. Appreciate it, sir. Thank you. Meantime, we're getting word that federal officials considered just one company to design healthcare.gov. That's the same website that's causing so many problems today. The latest problem? Wrong or incomplete data being sent to insurance companies. David Smith is a consultant who advises states and insurers on the healthcare exchanges. I've got some rapid-fire questions for you, David, if I may. As a consultant, do you think, looking at this system now, do you think that we'll ever be able to sign up millions and millions of people by the deadline?
Well, I would certainly say that as it stands today, it's a little difficult to imagine that. If we're having problems with hundreds of applications or maybe even thousands of applications on a good day, it's hard to imagine tens of thousands of applications in November and December. So clearly we have some design issues and some volume issues. The administration has definitely been treating some of the server capacity and bandwidth issues, but with some of the design problems in getting the correct enrollment data and information over to health plans, there's some really big problems that could present themselves
down the road.
So, David,
that's what you've identified, getting the right information from the sign-up process over to the health insurers who've got to use that information. You say that transfer of information results in false information and incomplete information. How's this happening?
Well, so every day there's a batch file that's made up of all of the enrollment files that are rendered to the exchange, and it's sent over to the health plans. And the health plans are supposed to be able to automatically integrate this information so they can start to reach out to the enrollees, get them the coverage, and start teaching them how to use that particular plan. Right now, the information that's being rendered, in some cases, the information is transposed, there's missing fields, so health plans are having to manually fix all of this. That's fine if you're doing hundreds of applications a day, but when you get into tens of thousands, health plans just don't have the kinds of resources to fix that manually, and it will create a huge bottleneck and the signing up of insurance, which really could delay the coverage date for some folks.
The word chaos and train wreck has been applied to the exchange system and the difficulties, the problems it's having. Would you go further? Would you say, and I don't want to put words in your mouth, but would you use the word collapse when it comes to this healthcare sign-up system?
Well, I probably wouldn't go as far as to use the word collapse. I think everybody in the industry had anticipated that this would be a rocky start and the implementation was not going to be an easy thing. Clearly, there have been some difficulties that were unforeseen and unanticipated, and that really in any private sector IT project you wouldn't have expected. But the federal government's responding to certain pieces of that. I really do think you're identifying one of the sleeper issues, though, Stuart, is really the enrollment transmission between the exchange and the plans. If we can't get this done in an automated way, I won't use the word collapse, but it certainly will create some enormous bottlenecks down the line. And look, at the end of the day, you might have consumers that are trying to enroll in this thing that become impatient, which really starts to affect some of that healthier population we need to be participating in these risk pools.
It most certainly does. David Smith, thank you very much indeed, sir.
Thank you.